I worked the registration desk at a private hospital in Bangkok. Last Tuesday, an American woman walked in bleeding from her hand after slicing it on broken glass at her hotel. She was holding a wad of napkins against the cut, blood seeping through. I asked for her passport and travel insurance details. She pushed the napkins toward my face and said, "I need a doctor right now, not paperwork." Explained we needed payment information first, since she wasn't a Thai citizen. She leaned over the counter and said, "In America, hospitals treat people first and bill later because that's how civilized countries work." I told her we would treat her immediately, but we needed her credit card on file. She pulled out her phone and started recording me, saying she was documenting medical negligence. My supervisor came over, processed her as emergency triage, and we admitted her. The cut needed 6 stitches and cost 4,800 baht, roughly 135 United States dollars. She stared at the bill and asked where the rest of it was, because stitches in America cost at least $2,000. "So you clearly didn't use real medical equipment." My cousin manages a pharmacy in downtown Guadalajara. A retired couple from Florida came in with a prescription for insulin. When he told them the cost was 380 pesos per vial, the husband laughed and said, "That's like $12. There's no way this is real insulin." My cousin showed them the manufacturer's label, explained it was the exact same Lantus they'd get in the States, just without the markup. The wife pulled out her phone and started Googling fake insulin Mexico, while her husband demanded to speak to whoever's in charge of quality control. My cousin called the pharmacist, who came out and explained that pharmaceutical companies sell the same products globally at different prices. The husband said, "So you're admitting you're selling us expired medication that failed US safety standards?" They left without buying anything. They came back 6 hours later and bought 8 vials because their American prescription had run out, and they couldn't afford to fly home early. I'm a receptionist at a medical clinic in Oslo, an American businessman came in complaining of back pain from sitting on flights all week. I gave him the standard intake form to fill out. He looked at the document and said, "Why do you need my complete medical history for a muscle relaxer?" I explained we need comprehensive information to avoid drug interactions and ensure proper treatment. He said, "My doctor in Dallas just asks what hurts and writes the prescription because he respects my time." I told him our physicians don't prescribe controlled medications without a full examination and history. He stood up, pulled out his phone and said, "I'm calling the US Embassy to report a healthcare access violation because this is discrimination against Americans with legitimate pain." Our head physician examined him for 20 minutes and determined he needed physical therapy, not medication. The American refused the referral and demanded real treatment, not socialist wellness seminars. He left and posted a 1-star review saying, "Norwegian doctors are undertrained and that our free healthcare isn't worth the wait." Even though he'd been seen within 30 minutes and his consultation cost 200 kroner, about $18. My brother works admissions at a public hospital in Mumbai. An American college student came in with food poisoning after eating street vendor food. She'd been vomiting for 12 hours. He asked for her passport and explained that foreign nationals needed to pay up front for non-emergency care since she didn't have international insurance. She said, "I shouldn't have to pay anything because I have travel insurance through my university and that covers everything worldwide." Brother explained she'd need to pay first and seek reimbursement from her insurer later. She said that's not how insurance works. It's supposed to prevent you from paying, not make you pay anyway. She called her mom on video chat, and her mom started yelling at my brother in English about third world scams, while her daughter dry heaved into a bin. My brother's supervisor processed her as an emergency case. They gave her 4 fluids, anti-nausea medication, and kept her for observation for 4 hours. The total bill was 6,500 rupees, about $78. She looked at the invoice and said, "This seems really low. Are you sure you charged me for everything?" When my brother confirmed it was correct, she said, "Well, I guess you get what you pay for," and asked if they had real hospitals with American-trained doctors nearby, managed patient services at a dental, practiced in Buenos Aires. An American woman scheduled a cleaning. and showed up expecting to be seen immediately. Our receptionist explained she was 15 minutes early and the dentist was still with another patient. The woman said, "I had an appointment at 2 p.m., which means the dentist should be ready for me at 2 p.m. The receptionist offered her coffee and asked her to wait. She refused and stood next to the reception desk with her arms crossed, checking her watch every 30 seconds. When the dentist called her back at 2:12 p.m., she said, "I'm reporting this delay to Google reviews because punctuality is a sign of professionalism." The cleaning took 40 minutes. The dentist found 2 cavities and recommended fillings. The woman asked how much it would cost. He said 25,000 pesos total, roughly $165 for both. She squinted at him and said, "Are you using the cheap Chinese filling material? Because in America, quality fillings cost at least $400 each." The dentist explained that labor and overhead costs differ between countries and that the materials were German-made. She said, "I'll think about it and get a second opinion from a real American dentist when I get home," and left. She came back 3 months later with severe pain from an untreated cavity that now needed a root canal. I worked the nurse's station. At a rural health center in County Cork, an American tourist came in with an allergic reaction to shellfish, her face swelling slightly. I asked for her details and explained we needed to see if she was registered with a GP in Ireland. She said, "I don't need to be registered anywhere. I'm having an allergic reaction, which is an emergency, which means you treat me immediately under international law." I explained we would absolutely treat her, but we needed information for our records first. She said, "Every second you waste on paperwork is a second my throat could be closing," even though she was breathing normally and speaking in complete sentences. Our duty doctor saw her within 5 minutes, gave her antihistamines, and monitored her for an hour. She was fine. The doctor explained she should avoid shellfish and carry an EpiPen if she had severe allergies. She said, "In America, doctors prescribe EpiPens automatically after any allergic reaction because prevention is part of the Hippocratic Oath." The doctor explained EpiPens are for anaphylaxis, which she didn't have. She said, "So you're telling me Irish doctors just let people die instead of giving them life-saving medication?" The visit cost her €80 because she wasn't an EU resident. She said that proved the NHS was falling apart, even though Ireland doesn't use the NHS. I'm a paramedic in Toronto. We got a call about an American woman who'd fainted at a shopping mall. When we arrived, she was conscious and sitting on a bench, sipping water. I asked what happened. She said she hadn't eaten all day and felt dizzy. I checked her vitals, and everything was normal. I explained she should eat something and rest, but she didn't need emergency transport to a hospital. She said, "In America, paramedics always transport to the hospital because that's the standard of care, and you could be liable if something happens to me later." Explained we only transport if there's a medical necessity, and she was stable. She said, "So you're saying Canadian healthcare is so underfunded you just leave people on mall benches?" I offered to call her a taxi to a walk-in clinic if she wanted a physician evaluation. She said, "I'm not paying for a taxi when I clearly need an ambulance." She refused to sign the non-transport waiver and said she'd see us in court if anything happens. We transported her anyway. At the hospital, she waited 3 hours in the ER because she was triaged as non-urgent. She filed a complaint saying Canadian emergency services were slower than a third-world country. My sister runs a physical therapy clinic in Stockholm. An American man came in with knee pain from a running injury. She evaluated him and designed a 12-week rehabilitation program with twice-weekly sessions. He looked at the timeline and said, 12 weeks. In America, they'd just do surgery and I'd be fine in 6 weeks because we believe in fixing problems, not dragging them out. My sister explained that surgery was a last resort, and that physical therapy had better long-term outcomes for his type of injury. He said, "That's what someone would say if they weren't qualified to do surgery?" She showed him studies demonstrating that conservative treatment prevented complications and cost less. He said, "Those studies are probably funded by European governments trying to save money on healthcare." He did 3 sessions, stopped coming, and left a review saying Swedish physical therapists don't believe in modern medicine. 6 months later, his wife called asking if he could restart the program because his knee had gotten worse, and his American orthopedic surgeon recommended 12 weeks of physical therapy before considering surgery. Work at a private clinic in Singapore. An American couple brought their teenage son in for a sports physical. The doctor examined him, said he was healthy, and cleared him for athletics. The father asked about prescribing vitamins or supplements to boost his performance. The doctor said a balanced diet was sufficient, and that unnecessary supplementation could be harmful. The father said American doctors always prescribe something because that's how you optimize health. You don't just tell people to eat vegetables. The doctor explained, evidence-based medicine doesn't support routine supplementation for healthy adolescents. The mother said, so you're saying you'd rather let kids be mediocre than give them every advantage? The doctor repeated that the boy was healthy and didn't need medication. The father said, this is why American athletes dominate the Olympics, because our doctors actually try to help us win instead of just checking boxes. They demanded a second opinion. The clinic director saw them, said the exact same thing, and they left angry. The visit cost them SGD $150, about $110. The father said that proved the doctor didn't care enough to do a thorough evaluation because quality care costs money. I manage a community pharmacy in Montreal. An American tourist came in with a prescription from his US doctor for Adderall. I explained we couldn't fill American prescriptions without a Canadian doctor's approval, especially for controlled substances. He said, it's the same medication. Why does it matter what country the prescription is from? I explained that different countries have different regulations and he'd need to see a local physician. He said, this is discrimination against people with ADHD because you're denying me medication I legitimately need. I suggested he visit a walk-in clinic. He said, so you expect me to pay for a doctor's visit just to get permission for medication I already have permission for? That's double billing. I explained I was legally prohibited from dispensing controlled substances on foreign prescriptions. He said, in America, pharmacists have professional judgment and can make exceptions. He called his doctor in Florida on speakerphone and asked him to authorize the prescription to me directly. I explained that wasn't how international pharmacy law worked. He left and posted on a travel forum that Canadian pharmacies refused to help Americans and that he'd had to go 3 days without his medication. I'm a nursing supervisor at a rehabilitation hospital in Christchurch. An American woman was admitted after a minor stroke. Her insurance covered her stay. Our standard protocol included daily physical therapy, occupational therapy, and speech therapy assessments. She completed 1 day of treatment and said she wanted to be discharged because she felt fine. Our doctor explained she needed at least a week of monitored rehabilitation to prevent complications. She said in America, patients decide when they leave, not doctors, because it's my body and my choice. The doctor explained that leaving against medical advice could result in serious health consequences. She said, you can't keep me here against my will. That's kidnapping. Her husband called their insurance company on speakerphone, and the representative said they recommended she follow the physician's advice. She said, even my own insurance is in on this scam to keep me here and run up the bill. She signed an AMA discharge form. The hospital bill was NZD $4,200, about $2,500 for 1 day. She said it proved hospitals everywhere just want your money. 3 weeks later, she had another stroke and was airlifted back to the States for emergency treatment. I'm a hospital administrator in Auckland. An American man needed an MRI for persistent headaches. We scheduled him for the following week at our imaging center. He said, a week? In America, I'd get an MRI the same day because doctors there understand urgency. I explained we prioritize cases by medical necessity, and his condition wasn't urgent. He said, so you're telling me I could have a brain tumor and you'd just make me wait because you don't have enough machines? I explained our radiologist reviewed his case and determined a 1-week wait was appropriate. He said, that radiologist hasn't even met me. How can they decide what's urgent for my body? I told him he could pay for a private MRI at another facility if he wanted it sooner. He said, so New Zealand has a 2-tier system where rich people get care and poor people die, just like America, but with worse weather. He kept his appointment. The MRI showed nothing abnormal. He said the doctor must have missed something because headaches don't just happen, and he'd get a real scan in America with better machines. Wife works patient transport at a hospital in Lima, an American woman. Needed to be transferred to a specialist facility across the city for a cardiac procedure. The ambulance arrived to pick her up. She looked at it and refused to get in. She said, "That ambulance looks 30 years old. I'm not riding in that. It's probably not even safe." The paramedic explained it was fully equipped and regularly inspected. She said, "In America, ambulances look like they're from this century because we invest in emergency services." The paramedic showed her the modern equipment inside, including a defibrillator and monitors. She said those could be fake or expired. "I can't tell just by looking at them." She demanded a newer ambulance. With American safety standards, hospital coordinator explained we only had one ambulance available and her procedure was scheduled in 2 hours. She said her insurance company would hear about this. She eventually got in. It transported her safely. After her procedure, she said the specialist was excellent and the facility was modern. So at least some parts of Peru are up to international standards. I coordinate international patient services at a hospital in Dubai. An American man came in for elective knee surgery. Everything went perfectly. During recovery, he started asking the nurses about their qualifications. One nurse said she'd trained in the Philippines. He said, "So they imported you because they couldn't find real nurses?" She explained she had a Bachelor of Science in nursing and 10 years of experience. He said, "But did you train using American medical standards or just whatever they teach in Asia?" She stayed professional and continued his care. Later, he asked another nurse where the doctor trained. She said the surgeon completed his residency at Johns Hopkins. He visibly relaxed and said, "Oh, thank God. A real American-trained doctor. That's why the surgery went so well." The surgeon was actually Pakistani and had only done his residency in the US after medical school in Karachi. The man's bill was 52,000 United Arab Emirates dirhams, about $14,000. For the entire surgery, hospital stay, and post-op care, he said it proved Dubai was trying to become the new America and that he'd tell everyone back home about the good doctor from Johns Hopkins. When the surgeon visited during discharge rounds, the man thanked him for bringing American expertise to the Middle East. I worked the emergency intake at a hospital in Brussels. An American teenager came in with his parents after spraining his ankle playing basketball. We did an X-ray, confirmed no fracture, gave him a brace, and advised rest. The father asked about prescribing pain medication. Our doctor said over-the-counter ibuprofen would be sufficient. The father said in America, doctors prescribe real pain medication because they take pain seriously, not just tell you to take Advil. The doctor explained that opioids were inappropriate for a minor sports injury. The father said, "So you'd rather let a kid suffer than prescribe something that actually works?" The doctor gave him a pamphlet about managing pain safely. The father said, "This is exactly why Europe has so many problems. You're so afraid of lawsuits you won't even help people in pain." The visit cost €95. The father paid with a credit card and said, "At least it's cheap. I guess you get what you pay for in terms of quality." As they left, I heard the mother telling the teenager, "When we get home, we'll take you to a real doctor who actually cares." I'm a triage nurse at a public hospital in Johannesburg. An American volunteer worker came in with severe diarrhea after drinking tap water. I checked her vitals and said she'd need to wait because we had critical patients ahead of her. She said, "I've been waiting 45 minutes and I can see people just sitting around." "So, clearly you're not that busy." I explained the waiting room isn't organized by arrival time but by medical priority. She said, "In American hospitals, they see you in order unless you're literally dying because that's how fair systems work." I told her she'd be called as soon as possible. She stood up and walked toward the treatment area, saying, "I'll just find a doctor myself since no one here seems to care." Security escorted her back to the waiting room. She said, "You're physically preventing me from getting medical care. That's assault." She was seen 90 minutes after arrival. The doctor prescribed oral rehydration salts and antibiotics. She looked at the prescription and said, "Just salts? In America, they'd at least give me an IV, because that's actual treatment. The visit was free under our public health system. She said that explained why the service is so terrible. Because when things are free, people don't value them. I work nights at a hospital pharmacy in Reykjavik. An American man came down to pick up his discharge medications after a 3-day stay for pneumonia. The total cost for his hospital stay, IV antibiotics, chest x-rays, doctor consultations, and discharge medications was ISK 180,000, roughly $1,300. He stared at the bill for a long time. Then he asked me to explain it line by line because something doesn't add up. I showed him each charge.